and thanks for joining us this week on Agenda 2030. I am Toyin Nkamiang John. Today, we will be taking you with us on a ride through the implementation process of the Sustainable Development Goals by the Government of Nigeria vis-a-vis the programs and projects implemented for the attainment of the goals. Do stay with us.
Agenda 2030. As a successor framework for the Millennium Development Goals, the global community rolled out a bigger, deeper, and more encompassing framework called the Sustainable Development Goals, designed to transform our world, lift the poor out of poverty, as well as ensure inclusive and healthy society. On Agenda 2030, we take you on a media trip to the global destination of the future we want. With everyone on board, we focus on the people and their struggle, the civil society and their agitations, the government and her development effort, the global development agenda, its 17 goals and 169 targets. We bring you all the deliberations, insightful conversations and high-level partnerships on the road to global destination. Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.
3 years into the implementation of the SDGs by the global community, Nigeria has taken a giant leap in the efforts aimed at attaining the goals. Here's Nigeria's concrete steps and pathway to localizing the global agenda.
The adoption of the 2030 Agenda for Sustainable Development and the Sustainable Development Goals SDGs in September 2015 was a watershed in global efforts to eradicate poverty, reduce inequalities, and protect the environment from degradation. The Nigerian President Muhammadu Buhari was among the world leaders who signed up for the adoption of the agenda. In apparent demonstration of her commitment, the Nigerian government has since embarked on a process for defining a clear pathway towards the achievement of the goals. First, the Office of the Senior Special Assistant to the President on SDGs was established with Princess Adejoke Orolokwe Adefulire as the coordinator of the agenda. A Presidential Council for the SDGs was inaugurated by the President to provide high-level policy guidance and leadership, as well as direction on the implementation, while 2 standing committees on the SDGs were also established in the Senate and House of Representatives of the Parliament to enhance legislative engagement. Active steps have been taken to mainstream the 2030 Agenda into national, state, and sectorial policies, development plans and budget as against embarking on standalone projects which lack sustainable characters. Work has also commenced on SDGs needs assessment, policy and scenario analysis, as well as tracking and reporting. Indicators have been developed and the SDGs baseline survey has been finalized to address the lack of accurate and reliable data for planning and tracking performance across the 3 tiers of government. Nigeria has also strengthened the national awareness around the goals, while strong commitment has been made towards effective collaborations with all stakeholders. The government has also set up the private sector advisory group and the Donors Partnership Forum with the civil society organizations recognized as key partners. As part of its efforts to prevent the drawbacks found with the implementation of the Millennium Development Goals, the government mobilized 400 core members across the country as SDGs champion to take the campaign on implementation of SDGs to the grassroots in various parts of the country. Also, 13 frontline celebrities have been enlisted as SDGs ambassadors to help communicate the messages of Agenda 2030, generate momentum and citizens' commitment for the achievement of the SDGs in Nigeria, raise awareness on all the goals with a view to enhancing actions by key players to attaining the SDGs. Beyond the very robust institutional arrangement for implementation, Nigeria is driving the SDGs with innovation as evident with the recent launch of smart classrooms in collaboration with global digital giant NetDragon Websoft. Nigeria has also put in place mechanisms for identifying and targeting the poor with pro-poor and pro-development programs undertaken in the quest to bequeath to the people a desired future in which no one is left behind. And for President Muhammadu Buhari, the message is simple.
Nigeria will continue to support the United Nations in all its efforts, including the attainment of the 2030 Agenda for Sustainable Development. I thank you.
Identifying obvious gaps and executions of pro-poor projects to address them are some of the hallmarks and best practices in the overall efforts in implementing the SDGs. Here are some of the projects being executed by the government to bridge the gap. Take a listen.
As part of its bid to galvanize efforts towards delivering meaningful development to the people, especially at the grassroots, the federal government of Nigeria some years ago introduced the Conditional Grant Scheme, CGS. The scheme, which began during the implementation of the Millennium Development Goals, MDGs, has seen the federal government co-funding pro-poor projects aimed at addressing socio-economic challenges like poverty, hunger, health, and illiteracy. With the adoption of the Sustainable Development Goals, the scheme was retained and repositioned for efficiency and effective delivery by the Office of the Senior Special Assistant to the President on Sustainable Development Goals. Projects executed under this scheme are implemented in partnership with the subnational government and are counterpart funded on 50-50 basis. The co-funding arrangement of projects between the federal, states, and local governments is designed to accelerate sustainable economic growth and development of all states and local government level, as well as to promote cooperation and partnership among the three tiers of government. The projects and programs are executed in communities where they are mostly needed to accelerate sustainable economic growth and development with a view to achieving the different goals of the 2030 Agenda. Particularly, the goals with social and economic linkages are targeted, and these include Goal 1, End Poverty; Goal 2, Zero Hunger; Goal 3, Good Health and Well-being; Goal 4, Quality Education; Goal 5, Gender Equality; Goal 6, Clean Water and Sanitation; Goal 7, Affordable and Clean Energy; Goal 8, Decent Work and Economic Growth. Checks have shown that projects executed under the Conditional Grant Scheme have brought succor to the people in the various communities where they are sited. In Kwara State, where about 24 projects are being executed under the 2017 round across 3 senatorial districts, the intervention efforts are already offering hope to the locals. The projects cover education, health, water, and sanitation. For example, the classrooms are either fully constructed or renovated and waiting for the arrival of the desks and benches to the classrooms. Officials say this will be delivered soon.
I was very happy. For construction of these classrooms and office and defense. I was very happy. I'm very grateful to the state government where the project comes from.
Inú mi dùn gan. Mo wà very happy. Pẹ̀lú bá ṣe máa yẹ kọ́ school yẹn fún wa.
A dúpẹ́ púpọ̀ lọ́wọ́ àwọn ìjọba fún ilé ìwé tí wọ́n fún wa.
Before, our students actually sat in the class and looking at the sky and the fire because they dilapidated structures. But we thanked the federal government and state government for coming to our aid.
And using this opportunity to appreciate government, both the federal government and the state government, for the job well done. We really appreciate it because it's the thing that we didn't expect.
In the health sector, the inspection team reported that renovation of the targeted primary health care centers have been done to specification and branded accordingly. Plans are afoot for the provision of ambulance vehicle, installation of solar headlights, installation of 5 kVA generators, and supply of medical equipment in all the centers. Temilade Okedare and some other residents in the community could not hide their joy when our team spoke to them.
We are so grateful for the government, for the new maternity that they brought to us here. We are grateful to them. We are so happy. In fact, we don't know what to say, just to thank them.
We really appreciate the SDG people that came to us and have lifted our structure, the primary health care. We really appreciate them. All the roof that have been leaking since all these days, we've been looking for somebody to assist us, but they just came like that and renovated everything. We say thank you. We don't know how we can just to appreciate you the more.
We appreciate this work that is being, it's a well done job. Everything has been placed into a good condition. So it is now a clinic that will be well conducive for the health workers to work in, because before when we finish doing our work, there will be no place to wash our hand unless we go outside to wash our hand outside. But now there's a running water now. The water is flowing fluently in every department.
In the area of water and sanitation, the Office of the Senior Special Assistant to the President on Sustainable Development Goals is drilling portable hand pump borehole. Construction of compartment and gender-separated VIP toilets have also been carried out in some of the schools. In Benue State, about 37 projects spread across education sector, water and sanitation are being executed across the 3 zones in the state under the 2017 round of the Conditional Grant Scheme. Just like it was the experience in Kwara, Abu Adama, a resident of Abaji, a satellite town in the Federal Capital Territory, described the project executed in the area as answers to their prayers over the years.
Government is trying. Project the government brought, we really appreciate their effort and we thank them for more projects that is going on.
Abuja City in the Federal Capital Territory is a sprawling city with magnificent and breathtaking structures. The city also hosts most of the foreign embassies and headquarters of many international organizations. Existing within a relative distance to the city are some satellite towns begging for social amenities, and their cries seem to be attracting the attention of the federal government through the Office of the Senior Special Assistant to the President on SDGs, who has, in the spirit of the global agenda, resolved not to leave anyone behind. The office has also extended intervention programs and projects to the communities. Through the Conditional Grant Scheme, the office has executed a comprehensive water supply scheme and also rehabilitated a block of 16 classrooms with the drainage and landscaping in the primary and junior secondary schools. In the same vein, the office has also completed the construction of a 5,000 cubic meter clear water tank, clarification tank, segmentation tank, raw water intake room, water pool and water reservoir to address the perennial water problem. While the projects executed in the various communities are targeted at alleviating the plight of the residents in the host communities, some of the projects have also suffered vandalism, as was noticed with the water project in Abaji. Also, the 350 kVA engine room and 300 kVA transformer cables were also not spared by the vandals. The Office of the Senior Special Assistant to the President on SDGs has, however, continued to raise awareness for the protection of projects cited in their communities, as the real intervention can only become more meaningful when projects are protected, accessed, and used in the interest of the people. The challenges notwithstanding, accolades have been pouring in. Only recently, officials of the United Nations applauded the Nigerian efforts in the implementation of the SDGs.
What is Nigeria doing? Where is Nigeria? What can we call success factors in the process of localizing the SDGs? One, an impressive MDG NDR report was established. This provided a framework to re-examine what was achieved within the Millennium Development Goals and also determine the unfinished business, which the SDGs brought a sharp perspective. That was followed by an SDG transition strategy. This strategy more or less gave a pathway on areas the government of Nigeria should engage as it starts implementing the strategy. We worked with the Office of the Senior Special Assistants to the President, and Nigeria did produce the first voluntary national review last year, which was quite an impressive effort in demonstrating some of the work that is done by the government and some of the investments that are already done and some of the coordination mechanisms that have been put in place by the government to guide the implementation of the SDGs. There's also work that is ongoing on the indicator data mapping and supply frameworks that are also critical to guide the accountability aspect of the ongoing effort. This is closely linked to the establishment of SDG indicator baseline reports that are already finalized. And the most interesting aspect is this multi-layered, multi-clustered coordination mechanisms that have been put in place to actually guide localization efforts. Besides the appointment of the Senior Special Assistant to the President on SDG, who has a very difficult job of ensuring vertical and horizontal coordination of this effort, a lot of progress has been made.
Observers believe that with the sustenance of the current pace, it is only a matter of time for Nigeria to substantially deliver on some of the goals.
Their joy knew no bounds. The people of Bakinkaswa Chukum local government area in Kaduna State had every reason to jubilate, celebrate, and heave a heavy sigh of relief when recently the Senior Special Assistant to President Muhammadu Buhari on Sustainable Development Goals, Princess Adejoke Orelope Adefurile, visited the community to hand over to them the healthcare facility constructed in partnership with the state government. For years, they have survived without the presence of healthcare facilities in their immediate environment. They have been forced to travel long distances to access medical attention when the need arises. This situation has forced the pregnant women among them to resolve to self-help when giving birth, or at best, patronize the traditional birth attendants with dire consequences in most cases. But hope located them. They, today, find succor in the construction of a fully equipped primary health care facility jointly provided by the Office of the Senior Special Assistant to the President on SDGs and the Kaduna State Government.
It is my pleasure to be here this afternoon to join His Excellency, the Deputy Governor of Kaduna State, to commission this important facility for the benefit of our children, our women, especially the pregnant women, and for the need for us to also get this facility available to reduce maternal death and infant mortality in this community. I'm highly honored to be here, and I want to thank the Deputy Governor as well as the Governor and our dear brother who is in charge of this project, the Honorable Commissioner for Planning and Project Commission, for being focused and for their foresight and in ensuring that this project is timely delivered. I was told that the project has been put into use for this community. It's a pledge that we continue to work with the Kaduna State Government to provide more of this facility for the benefit of the people of Kaduna State and Nigeria in general. So in this, therefore, my privilege and honor to commission this project in the name of God the Father, God the Son, and God the Holy Spirit. Amen.
The Primary Healthcare Center is one of the numerous projects valued at $1.2 billion jointly delivered to Kaduna State. The total project, numbering 124, covered upgrade and construction of primary healthcare centers, perimeter fencing, toilet facilities, staff quarters, solar-powered boreholes, and procurement of hospital equipment. Speaking at the event, Governor Nasiru El-Rufai, represented by his deputy, Barnabas Bantex, said that the projects were located in the 6 local government areas with highest number of maternal and infant mortality in the state. He identified the local government areas as Chukum, Kaura, Kachia, Igabi, Kubau, and Ikara. He thanked the Office of the Senior Special Assistant to the President on SDGs for supporting Kaduna State in its quest to improve the quality of life of citizens through the provision of quality health care. Inaugurating the projects, Princess Adejoke Orilokpe Adefurile, the Senior Special Assistant to the President on Sustainable Development Goals, said they were executed to increase access to quality healthcare services, particularly to pregnant women and nursing mothers. The presidential aide said that the projects were implemented under the conditional grant scheme of her office and pledged to continue working with the state in providing more healthcare facilities in rural communities. According to Princess Adejoke Orilokpe Adefurile, the society cannot talk about ending maternal and infant deaths when rural population do not have access to healthcare services.
Those that are pregnant already, the need for them to attend antenatal clinic. With this, you save a lot of deaths, because when you have a record in the primary health care center, since the day that you register, so when there's complication, they quickly trace your files, you know what actually went wrong, because they have your record. But if you don't attend, when you come on emergency, no reference, because you don't have a file that they will refer to. So there won't be any reference. So to treat you, the caregiver might find it very difficult to treat your history, your medical history. So if it's possible for us to eradicate, we will eradicate. But it has given a significant decrease in the number of women that give birth at home, and it's a very high risk. So putting this in place now will give a lot of comfort, opportunity for the pregnant women and the nursing mothers also to immunize their children. So we'll continue to partner with Kaduna State Government in this life-saving program for the benefit of Kaduna and the entire country, Nigeria.
She also added that her office is working with Kaduna State and other states across the country to improve the quality of lives of Nigerians through various interventions in economic, social, and environmental lives of the people. Muhammad Abdullahi, Commissioner, Planning and Budget in the state, explained that the projects became necessary after a survey in 2016 which indicated that 70% of pregnant women in the state deliver their babies at home, a situation that led to a high level of maternal and infant mortality in the state, particularly in the local government areas where the projects were cited. Honorable Yari Marcus, the representative of the people of Chukum in the State House of Assembly, expressed their appreciation of the people and added that the health facilities will significantly improve the health outcome of the state through increased access to quality health care services.
This is one of the projects we have been yearning for. This is a grassroots project where it's going to cater for maternity and so many other child illnesses. So this is a hospital that is first of its kind to be built in this community. So I'm so happy because we have 4 of these type of projects that have been given to my constituency. So I'm happy today. Many things will be put into use. I'm very happy for the Office of the Special Assistant to the SDGs, to the His Excellency on SDGs. I'm so happy. And I pray that God should keep this section for the betterment of our people.
And that's our package for the week. Remember, you can always watch the program and other episodes by subscribing to our YouTube channels on youtube.com/FreshNewsTV and youtube.com/Agenda 2030 TV. You can also watch the program live on Facebook. Log on to www.facebook.com/FreshNewsNG and www.facebook.com/Agenda 2030 TV. Follow us on all our social media platforms at Agenda 2030 TV on Facebook, Twitter, and Instagram. Remember to drop your comments and share with your contacts. Do use the hashtag Agenda 2030 and hashtag Agenda 2030 TV. Thank you very much for being part of the program this week. We will see you again next week. Until then, bye.